Mr. Gurupradha, Head Marketing and Sales, Sakra World Hospital, comes with loads of experience, and I would love to hear Mr. Panja share his experience about how he sees post-COVID, the aftermath of the COVID, how he sees the world changing in healthcare marketing. Mr. Panja?
Yeah.
Welcome, Mr. Panja. Over to you.
Yeah, you can hear me?
Yes, very well.
Okay, yeah. So it's Poonja. That's how.
Sorry, I'm Poonja. I stand corrected, Mr. Poonja.
Yeah, that's fine. Good evening to all the dignitaries and all the people who have glued in for this webinar. So I come from a purely marketing and branding background. I heard a lot of seniors speaking about the operational challenges, overall scenario in India, the way things are going to be pre-COVID and pro-COVID, and a lot of debates and a lot of discussions are going around the world. So what I'm going to do is that stick to core marketing. That's my forte.
Lovely.
And I think today in healthcare, everybody is looking at marketing as the ray of hope that these guys will bring in the numbers back and hospitals are back to their so that's how I look in that thing. So just a brief in terms of healthcare marketing. I think one of the statement made by Mr. Gopal Krishna a couple of minutes back is that marketing in healthcare is a virgin territory. I beg to differ a little bit. I've been in marketing from I think 2020 when I was part of WorkHard those days. Marketing has evolved. Yeah, so my marketing has evolved. From those days it was very orthodox, and the scope of marketing in healthcare was very, very limited. Marketing was all about connecting to the referral doctors community, talking about what kind of clinical infrastructure a health hospital has and how the referral community can benefit by sending their patients. It was more of a clinical sort of a platform we had with the referral community. We had a very minimal engagement with the corporates. Those days, it was more of wellness sessions, what we used to do with all the corporates in terms of talking to them in terms of preventive aspects. We used to talk to them of how do we prevent heart attack, how do we have the best diet in system. So a couple of topics were there. All the communication materials was very limited to magazines. The outdoor communication was limited to some hoardings and all those things. It was a very limited opportunity we had to talk to our customer base of patients. It got evolved in the last couple of years. The entire healthcare is just talking about digital marketing, and in fact, the entire team of in most of the healthcare hospitals, the traditional marketing team has been replaced by the digital marketing team. That's the way ahead. What has happened also is that from a personal interface, we have moved on to a digital interface sort of a process. Earlier, it was a very personal connect a hospital is to have with this customer base. That can be the referral doctor community, that can be corporates, that can be your neighborhood, community in large. It was far more personal. Things got changed into digital where, yes, the reach is much bigger, the scope is much bigger, but whether it is effective, whether what we are trying to do through the digital, is it really making sense? I still feel that we can debate on that, but right now in the current crisis where COVID has taken, everybody in healthcare is talking about COVID. So in my hospital, from security to the CEO, everybody is worried about COVID. And as marketing, my worry is that if we are 30% occupancy, my OPDs are closed. How do I now bring this back? And like all of you said, the new normal is that it is going to stay. It may be there for 6 months, it may be there for 8 months, it may be there for 1 year up. It may be there with us. You never know. It's a tough time. So from a marketing point, what I would like to say is that I think what's very important from a brand person is to rebuild the brand, get that assurance back to the patient that we are very safe hospital, and it's absolutely okay to come to a hospital. So that's a very important aspect. And one more thing, there are two things which today I think will become the base for the entire post-COVID management in terms of marketing. One is how effectively we are able to communicate about what hospital is doing, and how effectively we are taking care of patient safety. And from a marketing point, it's how we communicate about these two factors it will take the lead in terms of the way healthcare marketing is going to be defined for the next couple of months till this COVID is going to be there. So yeah, this is what I would like to share from my desk. Thanks.
Thank you so much, Mr. Poonja. I will be going across to Mr. Poonja and asking him branding in healthcare, how important, how critical it is for survival.
So I think the way we will look at the branding in healthcare is going to change or is already changed in the last couple of days. The purpose of branding pre-COVID was very different, and the purpose of branding during this period of COVID is very, very specific. I think the objective is to ensure that we are able to connect to our patient base in terms of what as an hospital we are doing, which is very, very important. Second, what are the patient safety awareness or the patient safety aspects of hospital which they need to know, and how branding is able to connect that is something which will be a very, very important part of branding in the current situation. So what and how is something which we need to answer. Key, what are the things which we need to do from a branding point? One is absolutely is that to create awareness among the general public, create awareness among the patients who have experienced you, create awareness among the healthcare workers who are part of your system. That becomes a very important part of branding. Second, and a very crucial factor is reliable and credible information. Today, I think in a period of COVID-19 and in the era of WhatsApp, universities and all those things, you get a lot of information on COVID management, a lot of information on symptoms and treatment plan. And I think as a healthcare provider, it becomes our principal responsibility to ensure that we give the right information, we get reliable information, which is really helpful for a general consumer, is really helpful for a patient who has different chronic conditions. I mean, in the past 6 years, Sakra would have treated thousands of patients, and they are finding it difficult to connect to our doctors. They're finding it difficult to come to the hospitals, and this is the time where, as branding, as a communication tool, we are trying to connect with them with the right information. It can be a cardiac patient who wants to know that I can't come to the hospital, I can't meet the doctor, what precautions I need to take. It can be a stroke patient who wants to understand how do I take care of my stroke conditions post the surgery, or I'm just at home. Or it can be a chronic diabetic patient. There are multiple clinical conditions where patients would like to know update from the hospitals, would like to know update from the treating doctors, what they need to do. So this is where branding will come into a picture in terms of their communication mechanism and communication tools. What also is important from branding point is to build that assurance among the patient that we are safe. For example, at Sakra World Hospital in Bangalore, and we are one of the few hospitals who have been identified for COVID testing by the government of Karnataka. How prepared we are doing that? Today we are talking to different healthcare providers that we are ready in case you have somebody who requires some kind of COVID support. We are always there, and this assurance is not only to my patients. This assurance is given to all the patients across healthcare. This again will come under a branding portfolio. How we are able to do that? So this is something which I feel is currently what branding need to do. And how do we do that today? Because of lockdown, because of limited ability to move around, we need to communicate. And how do we do that? And I think, as I said a couple of minutes back, I think digital communication is the route. And I'd like Sakra, all the hospitals are using different digital platforms to connect to their patients, connect to their consumers. Of course, you have a website which is a very interactive platform. For example, at our website, we have updated a complete mechanism or a system on COVID in terms of symptoms, in terms of what they need to do, in terms of precautions, in terms of the myths, in terms of the facts. Everything is updated. We have been creating multiple interactive platforms like webinars and Facebooks where our doctors are connected to general consumers or our patients in terms of giving information about COVID. We have created multiple very specific messages through our WhatsApp route, where we are speaking exclusively to our patients. We are speaking exclusively to our neighborhood community as hospital, what we are doing from a safety point, from a hospital update point. So to conclude, what I'm trying to say is that today branding in a COVID situation is all about communication, all about right communication, and how this communication is going to benefit both general consumer as well as your own patients who've been there with us for quite some time.
Thank you so much.
Yes.
Thank you so much, Mr. Poonja.